Begin here with a look at how experts are tracking the coronavirus pandemic both locally and around the world.
So NPR has created a tool that allows everyone to see how hospitals are faring under the strain of COVID-19. Now, the man who tracks our COVID-19 statistics says it's showing that our hospitals have been under extreme strain by unvaccinated patients who've now turned to hospitals to treat them. Michael Gibson has a story for us tonight at 5.
There are a whole lot of COVID-19 tracking sites out there, some developed by universities, others by the federal government. Of course, each state also tries to break down its own numbers.
What we might expect to see is in 2 weeks, a bump in cases.
That's Dr. Chris Bird talking about how the Labor Day weekend might help to spur another rise in our COVID cases. Dr. Bird is the lead for the Public Health District's Informatics and Modeling team. We showed Dr. Bird this national public radio site, which allows anyone to look up their hospitals to see how many of the beds are being taken up by COVID patients.
Thank you for bringing this study to my attention. It made me look at things in a slightly different way than I had been.
What impressed Dr. Bird was being able to take a look at things like the week of August 20th through the 26th. It showed that our hospitals were under high stress because of the percentage of people taking up hospital beds because of COVID.
Eye-opening thing in this graphic is how much of the adult hospitals are, stressed versus the overall number. It's even higher, right? There's 26 to 61% of either of the two hospital systems that treat adults being dedicated to COVID, and that's very eye-opening.
This site uses information from the Department of Health and Human Services as well as the University of Minnesota COVID-19 Hospitalization Tracking Project. Dr. Bird believes this tracker gives people a unique look at the pressure hospitals are under.
When 20% is extreme stress, and we're at 37% last week, that seems like more than extreme stress is something I think people can understand very well.
The nationally recognized Institute for Health Metrics and Evaluation at the University of Washington also points out that the strain on a hospital can also be measured by its ICU capacity. Researchers say that when 30% or more of the ICU beds are filled by COVID-19 patients, it suggests that the hospital is operating under high stress. And if 60% or more are full, it's considered to be at the extreme stress level. And looking at our numbers, you can see we are operating at the extreme stress level, and that's why everyone has been asked to continue to wear a mask and try to get vaccinated. Michael Gibson, 3 News.